One of our main aims during this COVID-19 pandemic is that no staff member or patient should contract COVID-19 at our hospital. This requires a rigorous approach to infection control around possible COVID-19 transmission. This presentation will focus specifically on the use of personal protective equipment at our hospital. Nkqubela TB Hospital has excellent protocols around protecting our staff against TB, but COVID-19 is transmitted very differently. Let us quickly recap how this virus is transmitted and try to summarize the important protective measures for each. I will discuss 3 transmission methods, with the first 2 being the most important. Firstly, immediate transmission. So a person that's infected with COVID-19 coughs infected droplets onto another person. Let's call this in the line of fire transmission. So droplets can't travel very far and won't reach your face if you are more than 1.5 meters away. The secondly is indirect transfer. So the infected person coughs up droplets that lands on surfaces around them. These are picked up, usually with our hands, and transferred to the eyes, the mouth, or the nose. Thirdly, we have what happens only in hospital settings, where during certain procedures we actually aerolize this virus, a bit like creating a spray can phenomenon. So these droplets can actually be inhaled, and this includes procedures such as sputum induction, intubation, testing, etc. Now, if you always think in terms of these 3 main transmission processes, the specific prevention methodologies become clear. So for immediate transmission, social distancing ensures you stay out of that line of fire. It is also recommended that everyone in the community wears cloth masks, which means that if there's somebody infected with COVID-19, they're not coughing droplets either onto others or into the environment. For indirect transfer, hand hygiene is by far the most important method to break this contamination route. It is only when we speak of aerolizing procedures that more extensive equipment such as N95 masks, visors, gowns and gloves become very important. Now let us look at the main items available for personal protective equipment and how they work. Note that hair protection and foot protection serves little purpose in preventing COVID-19 transmission. We'll start with masks, as this has become the iconic symbol of COVID-19 transmission prevention. But note that the major roles of mask is preventing the person who might have the COVID-19 infection from coughing it onto others or spreading it into the environment. Masks, unfortunately, is not a very effective way of preventing yourself from getting that infection. The only exception is when you are busy with an aerolizing procedure, such as testing somebody for COVID-19, where an N95 mask is recommended to prevent you from breathing in those particles. Gloves, unfortunately, is no better than hand washing, and only if you change them as often as you would wash your hands are they of some use. So a gloved hand transmits COVID-19 as effectively as an ungloved hand. They also cannot be used with alcohol-based sprays, as this may damage the integrity of that glove. Gloves are useful when used with a full PPE for example, aerolizing procedures and body care of patients. So let us look at eye protection, goggles or face shields or visors. For the immediate transmission route, it is much better to just rather practice social distancing or for community members to wear cloth masks. The only exception are a nurse or a doctor who is working within that 1.5 meter quarantine area around the bed of a patient that might have COVID-19 infection and importantly is not wearing a mask. Then it will protect them against the risk of the patient coughing onto her or his face. Eye protection has little or no use in preventing indirect transfer, unless you use a very comfortable visor that prevents you from touching your face. But goggles and visors do become very important when doing those aerolizing procedures. Lastly, we'll talk about aprons and gowns. Similarly to goggles, gowns are only needed to prevent direct transmission where you are within that 1.5 meter quarantine zone, and again the person with possible COVID-19 disease is not wearing a mask. For normal contamination prevention, for example leaning over a bedside or a consulting table, an apron is more than adequate. For aerolizing procedures, a gown is required, But for example, when testing low-risk patients such as community screenings, an apron will also be more than adequate. Now we understand all the components of our PPE, so let us look at our IPC and PPE measures for all our different zones within the hospital.